alternate identities are experienced as taking control in sequence, one at the expense of the other, and may deny knowledge of one another, be critical of one another, or appear to be in an open conflict. Occasionally, one or more powerful identities allocates time to the others. Aggressive or hostile identities may at times interrupt activities or place the others in uncomfortable situations.
Hi, my name's Daniel. I'm deeply in love with Rachel, and we've been going out forever. Okay, so we met in front of the library right after 7th period. I think it was the even day.
Why don't you ever bring me flowers?
Would you like one right now?
Why would I want any of these flowers?
They're really nice, man.
I look at this one, it's like dead and like...
Other ones are nice, like that red one's over there.
That red one? Come on. Really?
Okay, so everything went great on our date until tried to kiss her, and then everything just went wrong.
Kiss me.
Okay.
It's the only way I can imagine how much pressure.
What do you have to say for yourself?
I don't know who this guy is.
Individuals with this disorder experience frequent gaps in memory for personal history, both remote and recent. The amnesia is frequently asymmetrical. The more passive identities tend to have more constricted memories, whereas the more hostile, controlling, or protector identities have more complete memories.
Do you have the time?
It's almost 2. What are you doing? Ow!
Any other guy's backpack?
You just hit me! Yes, that's my backpack!
Oh, here.
What's wrong with you?
I'm so sorry.
An identity that is not in control may nonetheless gain access to consciousness by producing auditory or visual hallucinations. For example, a voice giving instructions. There may be a loss of memory, not only for recurrent periods of time, but also an overall loss of biographical memory for some extended period of childhood, adolescence, or even adulthood. Transitions among identities are often triggered by psychological stress. The time required to switch from one identity to another is usually a matter of seconds, but less frequently may be gradual. Behavior that may be frequently associated with identity switches include rapid blinking, facial changes, changes in voice or demeanor, or disruption in the individual's train of thoughts. The number of identities reported ranges from 2 to more than 100. Half of reported cases include individuals with 10 or fewer identities.
No one's gonna help you. Not for me, for you.
The main symptom of this disorder is amnesia, or memory loss of certain events, people, or even a certain time. This can be caused due to some trauma or accident. Depersonalization, a sense of being detached from one's body, and is often referred to as an out-of-body experience. Derealization, a feeling that the world is not real, or looking foggy or far away. Blurred identity, headaches and pains, time loss, trances, multiple behavior patterns, attitudes, beliefs, etc. Psychotic-like symptoms, including auditory and visual hallucinations. mood swings, sudden panic attacks, anxiety, phobias, depression, suicidal tendencies, sleep disorders, including insomnia, night terrors, and sleepwalking, compulsions and rituals, eating disorders, alcohol and drug abuse. Some people with dissociative disorders have a tendency towards self-persecution, self-sabotage, and even violence, both self-inflicted and outwardly directed. Someone with dissociative identity disorder may find themselves doing things they wouldn't normally do, such as reckless driving or stealing, yet they feel they are being compelled to do it. Some describe this feeling as being a passenger in their body rather than a driver. In other words, they truly believe they have no choice.
Never existed. With my imagination. Not real. You're Vicky. You're Vicky. No one else. Vicky.
Individuals with dissociative identity disorder frequently reported having experienced severe physical and sexual abuse, especially during childhood. Controversy surrounds the accuracy of such reports, because childhood memories may be subject to distortion, and some individuals with this disorder are highly hypnotizable and especially vulnerable to suggestive influences. However, reports by individuals with DID of a past history of sexual or physical abuse are often confirmed by objective evidence. Individuals with DID may manifest post-traumatic symptoms, for example, nightmares, flashbacks, and startle responses, or post-traumatic stress disorder. Self-mutilation and suicidal and aggressive behavior may occur. Some individuals may have a repetitive pattern of relationships involving physical and sexual abuse. Certain identities may experience conversion symptoms, or have unusual abilities to control pain or other physical symptoms. While there is no cure for dissociative identity disorder, long-term treatment is very successful if the patient stays committed. Effective treatment includes talk therapy or psychotherapy, medications, hypnotherapy, and adjunctive therapy such as art or movement therapy.
Oh, hi, Victoria. My name is psychoanalyst Peyton.
Okay.
Thank you for coming in today. I've been looking at your file, and I see that you have dissociative identity disorder. Are you aware of this disorder?
Yeah, of course, I've been over many times before.
You've gone to many of these type of appointments before? And have you learned anything about yourself or this disorder at your previous appointments?
All these things usually come during a stressful moment.
You are more likely to have problems during a stressful moment. Is this a stressful moment we're in right now?
Not really, no.
I don't know if I go like this. Is that stressful to you?
No, it's just
okay.
annoying.
Psychotherapy. It is the primary treatment recommended for dissociative personality disorder. This therapy, also called psychosocial therapy, counseling, or talk therapy, involves talking about this disorder with some mental health professional. This patient is helped by the therapist in remembering and working through the trauma, which initially triggered all these dissociative symptoms. The psychotherapy course is often long drawn and painful, but this approach is quite effective in treating dissociative identity disorder.